And to answer more questions, we're now joined by Dr. Brad Fuller with Fuller Family Medicine. Thank you so much for taking the time today.
Thank you.
First, we'll just start with the medical aspect. What are the biggest questions you are getting right now?
I think the biggest question is do I have coronavirus? And if there's a concern, how do I get tested? So those are the biggest two questions that we'll have. To help figure that out, I would recommend talking to your doctor. Don't just come in expecting to get a test, because we have to use certain clinical criteria to determine whether or not you would qualify for a test. For example, there's many viruses out there, bacterial infections that could manifest as such. So our job is to make sure it's not influenza. We can do a swab, and if that's negative, then we will consider maybe further testing, such as with the COVID-19 test kit. There's clinical criteria that we would have to use. Do you have a fever? Do you have a cough? Do you have shortness of breath? Have you traveled anywhere in the region recently or out of the country? Have you been in contact with somebody that may be infected?
All right. Now, as for those test kits, where are you on those right now? What are your thoughts on the test kits?
I understand Governor Bullock made about 1,000 available. I think more are on the way. Right now, we don't have any at our facility. I've been in communication all week with Riverstone Health through emails and telephone calls. Can we get the kits? They're still waiting. I called the emergency number last night at the State Health Lab, and they're going to be sending us 2. I've been able to figure out how to make these kits on my own, so I have the supplies coming next week. So I think we'll be prepared if and when we need it.
Okay, and how do we all put this into perspective for our families and our community?
I think we realize we're going to get through this. First and foremost, it's going to be scary. There's going to be a lot of frustrations and a lot of concerns, but there's been pandemics since mankind, and because of that, we will figure out how to get through it. There will be sad times, frustrating times, as mentioned, but we will get through this, hopefully in a matter of weeks or months, but this is something that we can treat eventually.
And remind us, common sense, cleanliness, what do we need to be thinking?
Social distancing, I think, is the biggest thing. Try to stay 6 feet away from your closest neighbor. Cover your coughs or sneezes with your elbow. Try to avoid your hand, because that's touching everything else and somebody will touch that. If you have a fever, cough, isolate yourself, call your doctor, stay home, don't bring that to work or to school. Kind of some of those common sense things to keep yourself at bay a little bit till we can figure this out.
All right. Well, thank you so much for your time.
Thank you, guys.
All right. Have a good night.